Hi, Dr. Turowski here. I would like to discuss with you one of the most popular procedures that I perform, which is eyelid lift or blepharoplasty. Believe me, this is operation not performed only for aging, but sometimes because even young, usually women or sometimes men, have a sleepy appearance. So there are not really different operations for these approaches. The only difference in young people is that sometimes we don't have to remove the skin and just approach the fat excess through the operation. What's different about the operations that I perform versus other surgeons? Upper eyelids can be addressed through the upper eyelid lift or upper blepharoplasty. This usually requires an incision on your upper eyelid that heals well and it typically is invisible. What I do is, in many cases, we combine it with the brow lift because that's what really happens, especially with the aging. It's not only the excess amount of the fat and skin, but also the drooping eyebrow. So make sure that we discuss that. I can do it through the internet. You can send me pictures. We can discuss this and send you up for surgery here. You can come a day before, have your surgery done, and leave a couple days later. About the lower eyelids, also my approach is probably different than some of the other surgeons. What I do is a little more complicated, but better for you because it minimizes the chances for complications. What I do is we approach the excess amount of fat which causes the bags under the eyes from inside of the eyelid. This is so-called transconjunctival or inside of the eyelid approach. We go in there, remove the excess amount of the fat, actually replace some of the fat to the groove that appears to be under the eyelid, put it back, not even closing the incision, and then approach the excess amount of skin from the frontal approach. There's incision right below the eyelashes, invisible once it heals, that addresses excess amount of the skin. Again, in young people, maybe not necessary, they may have enough elasticity that the skin will shrink. What does it do from your standpoint? Chances of ectropion, the most severe complication of the blepharoplasty, are minimized to a point that I'm doing this for 20 years and don't have even a single patient that had this problem. So eyelid surgeries are very tricky. They seem to be small and they can be addressed very quickly, but they can cause significant problems. So make sure you do your research, make sure you review the before and after pictures, ask your surgeon about the complication rate. One word of caution, my approach is to do lower blepharoplasty under anesthesia, too much pain, too much discomfort for the patient, but upper blepharoplasty can be performed under local anesthesia if somebody desires to do so.